Hello, you are most welcome, ladies and gentlemen, to today's tutorial. Today, we want to actually begin our journey looking at muscles, yes, of the thigh. But of course, we will actually go through muscles of the leg as well as that of the foot. So generally, yes, to get oriented, I want us to go through some terms that we are likely to meet as far as trying to understand, yes, the lower limb will be concerned. But today actually we look at muscles that form the anterior compartment of the thigh, which we call them the knee extensors. Generally we call them the knee extensors. So just by way of getting introduced, yes, there are some key terms that we have to understand, such as femoral. Now anytime you hear the word femoral, then it has to do with the thigh. Okay, then when we talk about patella, yes, we know patella is actually the kneecap and it's located in the anterior aspect, yes. When you are transiting from the thigh to the leg region. Now this patella, yes, regards to this, I mean the lower limb, trying to understand the muscles and all those structures over there, we will say it's actually the anterior aspect of the knee joint. Anterior aspect of the knee joint. Now the posterior aspect of the knee joint will be called popliteal. And then when we hear the word crural, then it has to do with the leg, actually the anterior aspect of the leg. Then when we see sural, then it has to do with the calf, the posterior aspect of the leg. Then of course we will be hearing the word peroneal, or which is also known as fibula. Then it has to do with the lateral aspect of the leg. That's peroneal. And when we hear tarsus or tarsal, then it has to do with the ankle. Then of course calcaneal has to do with the heel. Digiti or digital has to do with the toes. Okay, so if you hear of digiti minimi, then we are looking at the little toe. Then the great toe, we will call it hallux. The great toe is called hallux. And then when you look at the foot, the superior portion of the foot, okay, which faces upwards, is actually known as the dorsum of the foot. Now generally if we talk about foot, we call it pedal. Okay, so pedal, if someone presents with pedal edema, then it means the foot has swollen. Now the important aspect, and I've told you that the superior portion of the foot is known as the dorsum of the foot. The inferior portion, where we walk on, is the part where is actually in contact with the floor or the ground as we walk, is known as the plantar aspect of the foot, and that's the sole of the foot. So actually we want to actually begin our journey, yes, looking at this lower limb for now. But generally one thing that we have to know is that if you look at the muscles of the thigh, okay, this is the thigh. So if we talk about the thigh, okay, from here all the way to this side, that's the thigh. Now below this area will be the leg, and then we have the foot over here. Now the thigh, the muscles over there are organized into three groups, and we have the anterior thigh muscles, we have the medial thigh muscles, and we have also the posterior thigh muscles. But today we want to look at the anterior thigh muscles, and these muscles are the knee extensors. Now generally, because they are located in the anterior aspect of the thigh, then they will be supplied by nerve to the anterior aspect of the thigh, being the femoral nerve, from L2 to L4, ventral rami, actually that will be L2 to L4 levels. So that is what we are going to look at now. So without much ado, let's begin our journey looking at these muscles. But generally, I've told you that they are going to help extend the knee, they extend the lower limb at the knee joint. Okay, so this is the knee, and this is what we call extension. So if you move it all this way, then you have extended it. But if you go this way, you are actually flexing it, because the angle over here will be shorter or will be smaller compared to the angle all the way from here to here. So this is the extended knee. But if you, you position your lower limb this way, then it means you flexed the knee. And these are things that we have to understand. Now when we look at muscles of the leg region, we actually understand what we call, dorsiflexion and then plantar, flexion. Now dorsal, I told you about the dorsum of the foot, the superior portion of the foot where it's not in contact with the floor. That's the dorsum. So if you flex it so that the angle over here between the leg and the foot, okay, will be a bit, smaller compared to when it is, on the level ground. So this is a dorsiflex, foot. And then the opposite, okay, so that now in the dorsiflex position, what happens is that the toes are actually, elevated, so to speak, or they actually point, superiorly. And then the toes, when they point towards the ground, okay, then we say there is what we call plantar flexion. Because I told you that this area where is the sole of the foot is actually the plantar aspect of the foot. Okay, so if you flex it this way, then we have what we call plantar flexion. Okay, plantar flexion. So we actually be looking at all these ones. So now the first muscle, which is in the, although yes, we see it in the abdomen, yes, but it's also going to work on this lower limb, so we consider it to be part of this, what we call, anterior compartment of the thigh. And this portion is known as the psoas major, and this portion is known as iliacus, together combining to form, a common tendon known as the iliopsoas tendon. So this muscle, we will call it the iliopsoas muscle. Iliopsoas muscle. Now I told you that yes, generally the muscles of the anterior compartment of the thigh are actually knee extensors. Now this iliopsoas muscle, yes, is an exception. It's not a knee extensor, but rather what happens is that it produces what we call flexion at the hip joint, produces flexion at the hip joint. So by way of trying to understand its origin, what happens is that the psoas major, okay, there's a psoas major part of the iliopsoas muscle, will actually originate from actually the T12 all the way to L5. Okay, the bodies of T12 all the way to L5. Not only the bodies, even the transverse processes together with the adjoining intervertebral disc. Okay, and then of course iliacus will originate from the iliac fossa, and then they will join to form a common tendon, which we insert, okay, go posterior to insert on the what we call the lesser trochanter of the femur, So that is the iliopsoas muscle. And I told you that it's not going to be a knee extensor, but it is going to be a flexor at the hip joint, help to flex the hip joint. Now, of course, I've told you that all these muscles that I'm going to talk about will be supplied by what we call the femoral nerve. So that is what we find over here. That's the psoas major muscle. Now, the next muscle on the list, okay, is the longest muscle in the human body. Otherwise, we call it the talus muscle. Otherwise we call it the honeymoon muscle. I'm going to explain why we call it the honeymoon muscle. This is the sartorius muscle. Now this sartorius muscle, yes, you can see that it originates from what we call the anterior superior iliac spine, yes, and runs actually inferiormedially, okay, and inserts on the medial aspect of the proximal shaft, okay, of the tibia, okay, just below what we call, where we have the tibial condyle, medial condyle of the tibia, okay, that's where it's going to insert. Okay, this is a sartorius muscle. Now this muscle, what happens is that yes, it's going to be a flexor, it's also going to be what we call an abductor, okay, so that you can actually open your leg. Okay, so when we talk about abduction, then you are moving, what happens is that the lower limb away from the midline of the body. If there's the midline of the body, then when you move the lower limb away from the midline of the body, then you have abducted it. ABDUCTOR, abductor. Okay, abductor of the lower limb. Then again, it's also going to help in what we call lateral rotation. Okay, lateral rotation of the lower limb. But all these things are going to happen at the hip joint, But in addition, I told you that these muscles are actually extensors, okay, of the knee, extensors of the knee. So it's also going to help to actually help extend the knee, or produce some extension at the knee joint. Now, one thing that we have to know is that yes, this muscle, we are calling it the honeymoon muscle. Now, there will be one muscle when we look at the medial compartment of the thigh. We will get to know that there's this muscle known as the gracilis muscle, which is the virgin muscle, or the custodian of virginity. What happens, that helps what we call adduct. So if you put your your thighs together, then it means you've actually adducted them, added them together. Now this muscle is going to cause the opposite, which is abduction. So that during honeymoon time, if you have kept your virginity, then that's when you are going to make use of this muscle, okay, the sartorius muscle, to actually open your leg, open your your lower limb, so that the male can actually have intercourse with you. So this is the honeymoon muscle, the sartorius muscle. Yes, the next muscle on the left, which is still parts of muscles of the anterior compartment of the thigh, is known as pectineus muscle. Pectineus muscle, which is almost quadrangular shaped, actually going to originate from what we call the pectineal line on the superior ramus of the pubis. Okay, superior ramus of the pubis, and it will actually run somewhat inferior-laterally, to actually insert, on the posterior side of the femur. Okay, posterior side of the femur, just below where you have what we call the lesser trochanter. So the lesser trochanter, it will be here. So just below it, at the posterior aspect of the femur, that is where we have the pectineus going to insect. Of course, it's called pectineus because of its originating from what we call the pectineal line. Okay, so that is the pectineum. Now this muscle, yes, we know it's actually a hybrid muscle, which means that it's going to have dual innervation, because it's going to find itself in one compartment of the thigh, and of course in another compartment of the thigh. Now this pectineus muscle finds itself in the anterior compartment, as well as of course the medial compartment of the thigh, and therefore we say that to be supplied by nerve of the anterior compartment of the thigh, which is the femoral nerve, as well as nerve to the medial compartment of the thigh, being what we call the obturator internus obturator nerve. Actually, it's going to actually be the anterior branch of the obturator nerve. Therefore, it tells us that yes, it will actually pierce through the intermuscular septum, okay, separating what we call the medial compartment of the thigh and the anterior compartment of the thigh, okay, to actually get into the medial compartment of the thigh. So that is that muscle, okay. All right, so it is also one of the knee. Now listen, now this muscle is unable to reach the knee. Okay, so this muscle is unable to reach the knee, so it's not going to perform the function in actually flexing the knee. It's not going to perform the function in knee flexion. All right, now the next muscle that we have is actually a tuft of muscle. It's actually consists of 4 muscles put together as one, and that muscle is known as quadriceps femoris. Now we saw quadratus femoris in the gluteal region, actually one of the deep muscles in the gluteal region, but this one is quadriceps femoris, quadriceps femoris. Now this quadriceps femoris, yes, the name suggests quadriceps, then it has to do with 4 parts, having 4 parts in one, and these muscles, all of them will join to have a common tendon known as tendon, the quadriceps tendon, quadriceps tendon. It's actually going to form bulk of the anterior aspects of the thigh. Yes, and of course I told you there will be a quadriceps tendon which will actually connect to what we call the the patella, sesamoid bone, okay, to help increase what we call mechanical advantage, trying to increase its minimize stress on the knee, and also and then later, okay, you can see the tendon actually extends downwards to form what we call the patellar ligament, to insert on what we call the tibial tuberosity. So this muscle, yes, is the quadriceps muscle, and it's actually the main extensor of the knee joint. Okay, we're talking about these extensors, but this is actually the main extensor of the knee joint. So I'm telling you that there are four. Now from medial to lateral, we are going to have what you call, vastus medialis. Okay, you can say vastus medialis. Then of course we are also going to have what you call rectus femoris, okay, which is the most superficial of them. Then we are going to have what you call vastus lateralis. Now, if I reflect what we call the rectus femoris deep to it, I'm going to have what we call, vastus intermedius. Vastus intermedius. So these are how these muscles are arranged, but they will have different origins. They will have different origins. For instance, if we talk about, the lateral, vastus lateralis, then it's going to actually originate from what we call the greater trochanter, of the femur, as well as, of course, the lateral lip of the linea aspera. Now I told you that the linea aspera will have two lips. It's actually the lateral lip. So because this is actually coming from vastus lateralis, and of course greater trochanter is also laterally oriented. Okay, all the way from here, greater trochanter. All right. And then we also have what we call, vastus medialis. Okay, so if you look at vastus medialis actually originate from what we call the intertrochanteric line. Remember that between the greater trochanter and lesser trochanter anteriorly, we will have intertrochanteric line. So in between, that is the area that the vastus, okay, medialis will take origin from, as well as, of course, the medial lip of what we call the linea aspera. Okay, then for rectus femoris, okay, as you can see, it will actually originate a bit higher up, okay, actually coming from what we call anterior inferior iliac spine. Yes, so that's where it's actually going to originate from. Okay, and then deep to it, when I cut and reflect this muscle, then I'm going to have what we call the vastus intermedius, okay, which will actually originate from the anterior inferior aspect of the surface of the shaft of the femur, but of course all of them will actually converge to form a common tendon known as the quadriceps tendon. So that is that one for you. Now, one thing that we have to actually appreciate is that the quadriceps tendon, yes, can be used to actually test, okay, for the femoral nerve, or generally to test for the extension ability of these muscles at the knee joint. And in doing that, yes, what happens is that the patient will be asked to lie supine, so that his face faces upwards. Okay, so there's the supine position that the patient will be in. And what happens is that the patient will be asked to actually, okay, so initially the patient will have what we call flexed, what we call knee. Okay, the knee will be flexed a bit, and then the patient will be asked to actually extend the lower limb at the knee joint against resistance or against gravity. Okay, so if the femoral nerve is damaged, or if the extensors are not really working, then what will happen is that the quadriceps femoris won't be able to cause extension at the knee joint, because I've told you that that's the main extensor at the knee joint. So that is what we test for when we are actually looking at the femoral nerve. Okay, so that we want to test for the extensors at the knee joint. Now, having seen these ones, now one other thing too that we have to appreciate, yes, in the anterior compound of the thigh, okay, actually in the superior medial portion of the anterior aspect of the thigh will be this triangular shaped area known as femoral triangle. Okay, now this femoral triangle is very important, yes, because it serves as the channel, yes, through which structures that will maybe enter, okay, the thigh or leave the thigh, okay, will actually have to go through, okay, actually the anterior aspect of the thigh, okay, coming from the abdominal area, okay, into the thigh, or of course moving from the leg region all the way through the femoral region, and of course entering the abdominal region. You have to traverse through this area. Now this is also going to be important because there is this ligament over here which actually takes attachment from what we call the pubic tubercle, okay, to what you the anterior superior iliac spine. Now this is known as the inguinal ligament, which is actually a modification of the lower fibers of what we call the external oblique aponeurosis, okay, aponeurosis of the external oblique muscle, okay, will be modified to form this ligament, and this ligament is known as the inguinal ligament. Now this inguinal ligament is very important because it's more or less like serves as the flexor retinaculum, okay, which will help support the content of the femoral triangle, this triangle over here, okay, during flexion at the hip joint. So when you flex the lower limb at the hip joint, then what will happen is that the content will have to be stabilized, okay, be kept in place with the help of this inguinal ligament, acting as a flexor retinaculum, so to speak. Now, if we look at this triangle, what happens is that there are boundaries. Apart from the boundaries, you have the floor and of course the roof structures that will form roof of the structure. So superiorly, we are going to have this inguinal ligament that I've made mention of. Then of course, yes, on the lateral aspect, okay, there's a lateral aspect. Now remember that here there's a superior portion. As you descend, there's the inferior aspect. Okay, there's the medial aspect because you can see the pubic tubercle, and as you come here, then you'll be seeing the anterior superior iliac spine. Then of course there's the lateral aspect. So laterally, yes, there's this muscle, where is the longest muscle in the human body, known as sartorius muscle, okay. So laterally it will be bounded by the sartorius muscle, but actually the medial border, okay, this side, the medial border where the cursor is running, the medial border of the sartorius muscle will form the lateral boundary. Then of course the medial border, okay, so there's the medial border, will be formed by this muscle, and this muscle is known as adductor longus muscle. So when we look at the medial component of the thigh, we will get to appreciate this adductor longus muscle. But this adductor longus muscle is actually the medial portion, okay, not the lateral portion, but the medial portion of the adductor longus muscle, okay, will form the medial boundary of the femoral triangle. Then the apex will be formed when is the area where it's formed when of course the sartorius muscle crosses the adductor longus muscle. So that is that one. Now for the floor, what happens is that for the floor from medial, okay, to lateral, even the adductor longus muscle, whose medial border form the medial whose medial margin form the medial border of the femoral triangle, will actually be also forming the floor, form part of the floor, okay, from medial to lateral. So adductor longus muscle. Then of course we've seen this muscle, where is the pectineus muscle, taking attachment from actually the pectineal line, okay, this is the pectineus muscle. Then of course we also have the psoas major muscle, and of course iliacus muscle, of course, together forming what we call the iliopsoas muscle. So that is how the structures are arranged from medial to lateral in the floor of the femoral triangle. Now, how about the roof? Of course, there will be skin covering it. So the roof, yes, we are going to have actually skin. Then below that we have superficial fascia. Then within the superficial fascia, we have what we call the superficial inguinal lymph nodes, okay, will be present. Then of course we will actually also be looking at something like the femoral branch of the genitofemoral nerve, yes, of course, together with what we call the ilioinguinal nerve, of course the superior branches actually of the femoral artery will all be in there. Then beyond that, you have the deep fascia, and this deep fascia is actually the fascia lata. Then we also have the cribriform fascia. So from superficial to deep, you have skin, followed by superficial fascia, followed by deep fascia, that's the fascia lata, then of course the cribriform, fascia. So these are how the structures were arranged, forming what we call the roof of the femoral triangle. So that is that one. Now, having seen this femoral triangle, yes, you can still see it again. Okay, so there's the inguinal ligament, there's the anterior superior iliac spine. Yes, there's a pubic tubercle, so that's the attachment. Then there's actually the sartorius muscle, that's the longest muscle in the body. Then of course the adductor longus, actually the medial border of the adductor longus muscle. So there will be some content in this triangular area, triangular shaped area. And the content, yes, we can actually arrange them from lateral to medial. Okay, let me arrange from lateral to medial. We can also go from medial to lateral. So if we want to go from lateral to medial, then we use the mnemonic navel to help us. So from lateral to medial, N for nerve, so that's the femoral nerve. Then A is the artery, that's the femoral artery. But of course, you know that if we even have the femoral artery, there will be some branches of the femoral artery also being there. The proximal branches of the femoral artery will also be content of the femoral triangle. Then of course, navel, V for vein. And of course, even one of the main tributaries of the femoral vein being the great saphenous vein will also be there. Okay, the distal portion will be there. So that is that one. So that's femoral vein. Now I told you that it's navel. Okay, so navel, then it means that N for nerve, A for artery, V for vein, and E will be an empty area. This empty space will actually contain what we call the lymph node. Okay, will contain some lymph nodes. Now within this so-called space that I'm talking about, will actually contain what we call the femoral canal. Now I'll come to femoral canal pretty soon. Of course, the lymph nodes are going to be there. I'll explain that one pretty soon. Now it's actually the site where most of the hernias in the femoral regions occur. So femoral hernias will occur in that empty space that I'm talking about, where it's actually going to contain what we call the the femoral canal. And then L will actually be lymph nodes, the deep inguinal lymph nodes. So that's how the structures, but mainly just know these three main structures: the nerve, artery, and vein. They are all femoral structures, neurovascular structures. Okay, from lateral to medial, or you can also go from medial to lateral. That's vein, artery, nerve. So whichever way that you want to actually appreciate this, then you do that. So that's one thing. But one thing that I have to say, yes, I'll actually go through all these main structures. We look at their course and the various branches that they give, or the various tributaries that they give. Now this femoral nerve, what it's actually going to do is that in the anterior thigh, it's going to provide what we call sensory supply. Apart from that, even in the leg and the foot regions, we are actually going to see that. Yes, also gives motor structures, motor innervation to the muscles as well. So we actually look at all these ones so that we can actually have a complete picture of this one. Now, having talking about even nerve, now what happens is that although it's not the lateral most structure, there will be some kind of other nerves, like nerve to pectineus. You have pectineus over here somewhere. There will be nerve to it. It will also be a content of the femoral triangle. Yes, even apart from that, you have what you call the femoral branch of the genitofemoral nerve. Yes, as well as the lateral cutaneous nerve of the thigh. Okay, these are also going to be the content that we are going to find them there. Now I told you that. Now one thing is that there are three main structures. Now, unlike the femoral vein, which is not ensheathed, okay, in a sheet, which we call it femoral sheath, these two main structures, that's the femoral artery and femoral vein, will be in femoral sheaths together okay, with some kind of deep inguinal lymph nodes, where is the lymph node of Querquet of resemblance lymph nodes. Now we say that this one will be part, okay, will actually be the femoral canal. Okay, the femoral canal part, where is part of the femoral sheath, will contain these deep inguinal lymph nodes. Okay, so that is that one for you. Now, so if you look at it closely, what happens is that, yes, if you talk about femoral sheath over here, yes, we are going to see that it is going to enclose actually roughly the upper 3 to 4 centimeters of the femoral artery together with the femoral vein, the upper portion, the superior portion of them. And what happens is that, yes, this femoral sheath will actually come from the inferior extension of those kind of fascia in the abdomen, in the abdominal region. Okay, so what happens is that, for instance, in the anterior aspect, okay, anterior part of the femoral sheath, we will have what we call, it is actually contributed by the transversalis fascia. Okay, and then the posterior aspect of the femoral sheath will be contributed by fascia to what we call the iliacus muscle, and that's what we call fascia iliaca. Okay, so that's that kind of fascia over there. So one thing that you have to also appreciate from here, okay, you can see that this is not actually symmetrical. Okay, it's actually symmetrical. Okay, this is the vein, so it means that there's a medial portion. The lateral portion is actually vertical. It goes even almost vertical downwards, and it's quite longer compared to the medial portion. Now the medial portion is shorter, and it also moves obliquely, okay, inferior medially, inferior laterally, because the artery is going to be lateral, and then the vein is going to be medial. Okay, so inferior laterally. So that is one thing that we are going to see. Now within this femoral sheath, yes, I've told you that there will be femoral artery, yes, from the lateral aspect, but together with that we also have what you call the genital branch of the genitofemoral nerve. Okay, genital branch of genitofemoral nerve will also be a content of this femoral sheath. Okay, as you can see here. Then we will actually also be looking at this lacunar ligament, but let's go to the next. Now if you look at these ones, now what happens is that in the femoral sheath, okay, the structures over there, okay, will be separated. Okay, within the femoral sheath there will be structures, there will be septa separating the content. So there are going to actually be 3 compartments, okay, in the femoral sheath. So we have the lateral compartment, okay, or the arterial compartment. Okay, so if you hear of the lateral compartment, that's actually the arterial compartment, and this arterial compartment will actually contain the femoral artery together with the genital branch of the genitofemoral nerve. Okay, as you can see there. Then the intermediate, okay, compartment will also be referred to as the venous compartment, because it contains the femoral vein, okay, over here. And then the medial compartment can also be referred to as the lymphatic compartment, because it's going to contain the deep inguinal lymph node of Querquet, lymph node of Rosemola. So that is what we are going to see. Now I'm telling you that this medial compartment, okay, will actually contain will be also be referred to as the femoral canal. Okay, so the femoral sheath over here is referred to as the femoral canal. So femoral canal is part of the femoral sheath, where we are going to find the deep inguinal lymph nodes. So it tells us that there will be septa. Okay, so this one will be the the lateral septum separating the arterial compartment from the venous compartment, and there will be a medial, yes, septum, okay, separating the vascular compartment from the lymphatic compartment. So that's what we are going to see. Now one thing too that we have to know is that the lymphatic compartment is actually the smallest of these 3 compartments. of the history compartment. So I mean, that's what I mean we see over here. Now I want to actually explain the femoral I mean canal briefly. Now it's saying that there will be femoral sheath, and within the femoral sheath, with the exception of femoral nerve, yes, femoral artery, femoral vein, even together with that kind of genital femoral nerve, genital branch of it. I mean, some lymph nodes will be content, okay, of it. Now, this femoral canal, which is part of the femoral sheath, yes, you can see it over here. It's actually roughly conical in shape. This small space over here, that's the empty space I was talking about, okay, is the femoral canal. Okay, so I mean, this femoral canal, yes, I mean, it's going to be from the base over here will roughly be 1.5 centimeters, okay, width, with its length also being roughly around 1.5 centimeters long. And then one other thing too that you have to know is that there will be boundaries. Okay, there will be boundaries. Now for the boundaries, anteriorly we are going to have the inguinal ligament. Okay, so as you can see, the inguinal ligament is over here. So anteriorly we are going to have the inguinal ligament. Okay, and at the posterior aspect we are going to have at the posterior aspect, you can't see it here, but posteriorly you saw that I mean there was some kind of pectineus muscle, okay, together with its fascia will form the posterior boundary. Then at its medial portion, okay, as you move this way, then you are going medially, okay, because this is the femoral vein, this is the femoral artery. As you move this way, you are going laterally. So at its medial portion we will have this actually ligament over here being the lacunar ligament. So it's actually the concave area of the lacunar ligament. Okay, the ligament over here is actually the concave area of the lacunar ligament, which forms the medial boundary. And then on its lateral aspect, okay, will be actually the intermuscular septum, actually going to be the medial intermuscular septum. Okay, medial intermuscular septum, but together with of course the femoral vein. But actually the septum over here, which you separate it, okay, there will be lateral intermuscular septum, and of course the medial intermuscular septum. Okay, so that is how these structures are going to be related to the femoral canal. All right, now so I want to actually end with what we call the adductor canal. Now there is this muscle which we saw, which was the adductor longus muscle. We also have adductor brevis, and of course magnus muscles. Sorry, for instance, we are going to have the adductor, okay, this the adductor magnus, okay, because it's going to insert on what we call the adductor tubercle. But there's a small space over here which is created. That space is known as adductor canal because within the adductor magnus muscle, so we call it adductor canal. Now what happens is that yes, this adductor this area will be the adductor hiatus, okay, the opening over the hiatus. Now there's a space, there's a channel, okay, right from where the apex of the femoral triangle ended all the way to this area. We call it the adductor canal. So this adductor canal is actually is also conical tunnel, which will actually, yes, we find it in the thigh. Yes, roughly is going to be roughly 15 centimeters long, and it will actually extend from the apex of the femoral. So looking at this will be the apex of the femoral triangle, okay, the femoral triangle. So it will extend, yes, all the way from the apex of the femoral triangle, yes, and it will actually end at the adductor hiatus. So it is going to serve to actually transmit structures. Now remember that the adductor muscles are in the medial compartment of the thigh. Now the femoral triangle, okay, is in the anterior compartment of the thigh. So it tells us that yes, structures can move all the way from the anterior aspect of the thigh, okay, to the posterior aspect of the leg. through what we call the adductor hiatus, through the adductor canal, okay, actually exiting via what we call the adductor hiatus. Okay, so that is what we're actually going to see. So it tells us that yes, on its anteromedial portion will be this muscle, the longest muscle in the human body, known as the sartorius muscle. And then of course, when we look at the lateral boundary, okay, this is a cross section of the sartorius muscle, Now if we look at the lateral boundary, we are going to have what we call the medial border of what we call the vastus medialis. Okay, will form actually the lateral boundary. But posteriorly, we are going to have the adductor longus muscle, as well as of course the adductor magnus. So there's the adductor longus muscle, and together with the adductor magnus muscle. Now, one thing that we have to appreciate is that we are going to have some structures in it. Okay, so some structures which were in the femoral triangle, moving all the way to enter the posterior aspect of the leg. So there will be similar structure. So there's the canal, okay, that is going to go through. I told you it's roughly 15 centimeters long. So actually the structures, we are going to have what we call the femoral artery going through it. Okay, so femoral artery, okay, running all the way through it, through the adductor canal. Yes, we also have the femoral vein. Okay, but what happens is that the femoral vein will run behind the femoral artery. Okay, femoral vein will be a bit deep to what we call the femoral artery. Now remember that in the femoral triangle, the femoral artery was actually lateral to the femoral vein. Now in the adductor canal, what happens is that the femoral artery will be superficial, and then the femoral vein will be deep. Okay, so run behind the femoral artery. And what happens is that yes, there will be some other nerves, some nerve to vastus medialis, as well as of course the saphenous nerve will be there. Okay, so saphenous nerve will also run there. We actually cross them superficially, cross the femoral artery and of course femoral vein superficially. So it means that even when we want to actually locate the femoral the saphenous nerve actually, then we can actually locate it by actually identifying the femoral artery and the femoral vein, So that is that one that we are going to see. But one other thing too that we have to know is that apart from these ones, what happens is that after they've crossed the adductor hiatus, now these structures will now change their names. Okay, after crossing the adductor hiatus, they will now be called popliteal neurovascular structures. Okay, so for instance, the popliteal we will have the femoral vein being now called popliteal vein, and the femoral artery being now called popliteal artery, because I told you that yes, this is the patellar area. Posterior part of it will be called popliteal. So it's just the same structure, but depending on where we find it, the name will just change. Okay, so that is what we are going to find over there. Now what happens is that yes, there could be another situation where we can actually block we can actually block, do what we call adductor canal block. Okay, and we perform that so that we block nerve, the saphenous nerve, okay, as well as sometimes even the nerve to vastus medialis, and when that happens, you can see this nerve. This is the vastus medialis, so the nerve that is supplying it, and this is the saphenous nerve. So if we can do adductor canal block, so that we actually will anesthetize these two muscles, these two nerves. Okay, usually these two nerves, And when we do that, then what will happen is that it will help whenever we want to, let's say, perform some kind of surgery, okay, in the distal thigh, okay, as well as, of course, in the knee and leg area on the medial side, then we can block this one. Okay, so if you block it, then of course the femur around this area, distal aspect of the femur, okay, won't get sensory supply, as well as, of course, the knee area together, with the medial aspect of the leg, okay, because there's the medial portion, okay, will be an exercise so that you can go through the surgical procedure, successfully without pain, okay, to the patient. So that is that one for you. Now, again, one other thing too that we have to know is that there could also be what we call adductor canal compression. Okay, so this is actually a syndrome which is seen, when there is entrapment, of course, the neurovascular structures, the femoral artery, femoral vein, of course, the saphenous nerve, nerve towards medialis. Okay, so when they get entrapped, okay, in what we call the femoral canal, then that is what we call adductor canal. Then we call it entrapment in the adductor canal. So that is what we are going to see. That's what we're going to see. Now, this entrapment is actually quite common in young males, and may cause what you call claudication, and may present with, of course, neurological signs and symptoms. Okay, that's claudication. So you may also appreciate that one in that regard. So for this tutorial, we've been able to actually appreciate the various muscles which are going to form the anterior compartment of the thigh. Yes, these muscles are the knee extensors generally, but of course some of them may not necessarily extend the knee. Yes, for instance, the iliopsoas, if you look at for instance, the pectineus muscle, yes, these ones may not do that. And then of course we've seen actually the femoral triangle. We have to know the boundaries of the femoral triangle, the content of the femoral triangle. Then of course that the structures in the femoral triangle, in the anterior compartment of the thigh, will actually get to the posterior compartment of the thigh, and then even get to the posterior compartment of the leg. They will have to go through a tunnel known as the adductor canal, and it will exit via what we call the adductor hiatus. Okay, so that you can do all the various, there could be entrapment in there, there could be anesthesia application over there, so that we can help in that regard. Ladies and gentlemen, I hope you find this tutorial helpful. So in our subsequent meetings, we will actually be looking at the various muscles of the lower limb, and then we get a complete picture. Thank you very much, and may God richly bless you.